resources that you have available. Not to mention building out thoughts on the aquatic center and youth sports. Could Federal Way, could this region be a destination for youth sports and building a whole slew of businesses that go along with that, supporting it from hotels and hospitality, entertainment, and all the things to do this. We've seen a lot of communities around the country really hone in on these things. And really, if some of that investment is put in an overall package, the marketing, the story put together, how could this help improve the reputation of the region and in turn spur additional investment in those types of businesses, whether it's in wellness or those that are providing services, and all of that ultimately, hopefully, improving community health outcomes in the end. Because one last idea that I know came out of this that I like too is, well, these are all great ideas, but how do we drive this forward? We're perhaps creating a community health working group with businesses and service providers that can really focus in on where these investments make sense. What can we do? How do we better both put things on the ground to make this work and tell our story better as a region to make this grow together? Okay. So other side, thinking about retention expansion, those healthcare operations that are here, from the hospitals to the wellness businesses and others, how do we really help them sustain and grow others? One part is the workforce. We already talked about that. People need workers. It's a critical need across the country. But there's some challenges there in other ways. But with healthcare services overall undersupplied here in King County, and many expressing that challenge having to wait months and other times for appointments or having to leave the region, how do we really explore more outpatient care options that could expand as hospitals maybe shift away from inpatient to reduce costs? Alongside wellness care and others, alongside more of those practitioners that are offering more flexible options here. If we can't build new hospitals right away, that might take some legislative work and could be its own effort here. How do we continue to explore and tell a story to potential businesses and others of the gaps that they could fill here serving residents? And ultimately, this is again going to help not just create business, but help with community health overall. Because if residents today, especially lower income residents, are struggling to find timely, affordable care in the region, they're going to get less preventative care, there's going to be higher costs, deferred treatment, and all of these, in the end, reduce our overall health here in the community and of the economy. And so the last place to touch on too is on what else can we attract in that we don't have today. And I think those freestanding centers for emergency care, ambulatory care, and others are some of those gaps that potentially could be filled a little more easily considering the regulatory environment. How do we explore more alternative care, wellness businesses, and others as insurance companies and major systems begin to realize how important preventative care and wellness, this has been a trend for many years growing, that we need to be investing in the preventative care and overall health of our community. How do we explore bringing more of those in to support our people and grow the business? But then really building on the overall Seattle Metro strengths of life sciences, where there's an opportunity to leverage the space availability and pricing, because as challenging as affordability can become down here, you're still more affordable than being in downtown Seattle. And exploring where there are opportunities to build research centers here, or an area in particular can be contract R&D and manufacturing. A lot of small startups are developing pharmaceuticals and other products. They're developing, they don't manufacture them necessarily in a high cost life sciences lab in a city, and they look to other locations, many often overseas or out of state, but are there opportunities to build more of those facilities here and attract those in? The light rail expansion really has the potential to enhance a lot of these opportunities. It's going to make it's going to very quickly shorten the distance between you and the University of Washington. But these sorts of things don't happen overnight. We've talked about these in other communities, that they're not just going to look down and say, "Oh, that's great, we're going to build down here." There needs to be some of that proactive work of engaging with the life sciences community up there, exploring those opportunities and what they look like, and identifying some of those sites and areas that could be built out to be a place that could be a cluster to expand that industry down here into South King as well. So that's a lot. I'll take a little break here. Any kind of questions here? Well, it's got me up here on the stage. Oh, that's up. Dan's up. Yeah. What's the first step? I think You know what's directly in your control is this. Yeah, you are a city that controls your own investment, your own space, is thinking about what you can do to build that connectivity, to do the wayfinding. So when you get out off the train, the South Transit train, you look out, there's a map that shows you everywhere you can walk and go in Federal Way, where there's parks and connections there. Building that story, this to me is the low hanging fruit. So I would say this is where you begin with what you can control most directly, and then begin to build more of those external relationships and develop those things. The workforce development side as well. So talk to Green River, talk to others, see what you can do with your organization or as an individual to support people getting access to education. If you're in the healthcare supply chain world, how can you be getting into schools and telling your story and showing people what careers and things look like? But those are the two easiest places to start. Oh, one more. If you listen, do you have a question? Yes, ma'am.
So I just wanted to make sure everybody understood. But it said social determinants of health. We call it social drivers of health, SDOH in healthcare. But notice only 20% was really related to healthcare.
Yeah.
80% was related to all those other things. So our world is pretty complicated in the healthcare system, as you can already see, right? So I just think that, and I'm so glad the president of the St. Francis Hospital will be joining the chamber going forward to really talk about how we can tell our story. Because we already have a partnership with Fairway School District, right? And working on that. We want to talk with organizations like yours to talk about when you have care with your patients that you can't do and they need to come into the hospital. How do we have those conversations? We have federally qualified health centers here, CMAR and Health, and having greater conversations with them so the work that they can't do, they can come to us and negotiate that. But finding out who all those people are, how to make those connections, right? When every day our emergency room sees over 150 patients, that's difficult, right? And so my president is not here, couldn't be here today, but just to let you know, those are the kind of issues that we want to be able to work on so that we can really talk about the right things that are already happening here. How do we keep it going?
Yeah, thank you. And this is a starting point, but hopefully it can meet some other steps. 25% is a good point. I mean, the economic stability one alone, it's it's tough to see, but you see those health statistics, but you also see lower income levels here in the community, and this is should not be a surprise as unpleasant as it is to see, but generally lower income will correlate to lower health outcomes. And this is things that we need to proactively be addressing as building up our economy and people's economic health will in turn affect their physical and emotional and other health as well. Yep. Representative Reeves.
Hey, Tony. Sorry for being late. Thank you. Christine Reeves, State Rep. I am curious to understand as part of your presentation, it seems like a lot of the focus is on the service delivery model of healthcare as an economic driver. I'm curious, as you've kind of looked at this assessment, where the federal factors play into the potential future. 25% of the state budget relies on federal funding. We are watching a federal administration that is decimating Medicare and Medicaid, which part of our economic modeling is built on local contributions, state contributions, federal contributions, and then individual consumer contributions. I'm just curious, as you've done this assessment, how much of that instability in the federal healthcare economic outlook has played into the factors that you've included in this report?
So, we started this before a lot of that happened, or is happening. I would say it a lot. When we're talking about the life sciences in particular, let's start there. Cuts to NIH funding, cuts to a lot of fundamental research and development are creating massive challenges in the research and development community in Washington, in the Boston region, everywhere. The chances of there being a lot of expansion in life sciences in the immediate term are not strong. Let's say immediate term, the next couple of years. But as an industry, this has been growing rapidly for a long time, and it's not going to stop. There's basically the other side too is venture capital funding has been incredibly strong with supporting that. So are we hoping to see more of the private sector investments stepping up to fill some of those gaps? Yes, and hopefully that will continue strong because there's a lot of returns in research and development around pharmaceuticals and other areas like that. So that's one. But when you talk about expansion down, the South came a little bit of the life sciences. I would say, we can start laying groundwork, but it's going to be tougher. Even things like wet labs. The last 4 years, everybody's saying wet labs, wet labs. We need wet labs. Well, we probably overbuilt some wet labs now, and with this slowdown, that's probably not immediately opportunities that are going to build out as well. They're not going away though. It's just we're kind of in a pause period. The federal funding side on Medicaid, on hospitals, and all those other things, that is not my area. It's a ball of yarn that I have a very hard time unraveling. But I will say, having these conversations in a lot of different states, people are very worried, and that's just base operations of hospitals everywhere. That's state budgets, all of these things. I think either there are going to be cuts, or there already are cuts happening to staffing and services, or states are trying to explore how they can step up and fill some of those gaps. But finding funding for that, there's always finding funding challenges for anything is tough. There's a lot of discussion about how philanthropy can step in maybe on some of these areas, but it's going to be interesting times, and there's going to be a fair amount of reconfiguration, I think, happening across the board.
Thank you.
So the last thought, though, too, this goes kind of that social determinants of health and other things, but yeah, this isn't exactly a quote from somebody else. It was an amalgam of things I was thinking about and putting together. But really, that a healthy community is one where everyone has access to resources, opportunities, not just for their well-being, but also to create a business, to work in a good business, to grow and prosper. And this means, as we've seen, investing in education, that built environment that we all interact in, employment and growing businesses and their income, the social supports that really make this work to help people complete degrees. It's not as easy as saying, oh, you go and get a nursing degree. It's like, well, if you're working a job right now, you can't be out of income to pay your rent and do the childcare. It can be really hard to get that training. How do we have the support systems that really make this work? And overall, creating that system where everyone has that potential to thrive, regardless of their background or their circumstances. And that's how we're going to help make all of this work and lead to a more healthy community. So thank you very much. I appreciate that.